Good afternoon, good morning, maybe good midday to some of you out there. Thank you for joining the symposium today, sponsored by Genentech. And before we get started and I turn it over to our moderator, I would like to just spend a minute or two reviewing some of the housekeeping information. So if we can go to the next slide, please. Just to remind you all that when you joined, your camera and your microphone are disabled, and that's to ensure that our panelists, have the freedom to talk and don't have background noises. We also want to let you know that if you want to optimize your Wi-Fi, turning off any other devices around you that use Wi-Fi might help to ensure a stable connection. And we want to make sure that if you have questions during the webinar, that you use the chat function. So we'll be collecting the questions throughout. And at the end, assuming that we have time, which is our plan, we will answer as many questions as we can. I did want to note that we are not able to respond to anything that's off-label. So if there is a question that comes in that we're not able to answer, I won't be asking that to the panel. But please always feel free that you can follow up with your HCP. And or your local Genentech PAL to follow up on any questions that you might have. In addition, the full prescribing information can be found in that chat function. There is a link there that you click and it will take you to the full prescribing information on Evrysdi. Also, you may want to use the right click on the view that is up in the top right hand corner, and you can hide anyone that's a non-video participant. So that will allow, from a viewing perspective, when we have the panelists on, that you will just see them. All right, so now I want to introduce our moderator, Michelle Coupé, our acute care nurse practitioner at Stanford Healthcare in California, and she'll begin our presentation and our panel discussion. Thank you, Michelle, for being here. We really appreciate it.
Welcome, everyone, and thank you for joining our webinar today. As a nurse practitioner who cares for patients with SMA, I'm honored and grateful to be here for a conversation focused on adult perspectives living with SMA and how they are moving ahead. I love working with the community members I care for, hearing about their lives, their goals, and their journeys along the way. We know SMA is a progressive disease causing muscle weakness and loss of function over time. This happens to people with all types of SMA, even if you don't notice day-to-day changes. Yet, there are so many inspiring stories out there. Today, we'll hear from two panelists about their goals, their choices, including taking action to treat their SMA and their experiences. Our panelists are living and leading vibrant lives. I'm happy so many of you have decided to join us today. But before we begin, I'd like to thank the MDA for hosting another great opportunity for the community to come together to learn and to hear from each other. Next slide. As part of their journeys, both of our panelists chose Evrysdi, the only oral non-invasive at-home therapy for SMA. I talk a lot with my adult SMA patients about treatment, especially since the notion of treatment wasn't available 8 years ago as an option. As part of this discussion, I'll review some relevant information about Evrysdi, but more importantly, you'll hear from our panelists about how they are navigating life with SMA and choosing to move forward. I'm thrilled that they are here to share their stories and to answer questions. But before we begin our introductions, please submit any questions via the chat function, and we will address them at the end of our program. I'd like to welcome you to our two panelists who are joining us from opposite sides of the country. Jose, who has type 3 SMA, is joining us from Florida, and Janelle is joining us from the island of Hawaii. She's living with type 2 SMA. Thank you all for being here today. Next slide. Just a few things to keep in mind before we begin. These are some disclosures. This program is intended to provide just general information about Evrysdi, not medical advice. Evrysdi is not a one-size-fits-all drug for everyone, so we ask that you speak to your medical provider. There are individual results again, and so Evrysdi may not be appropriate for everyone. This program is presented on behalf of Genentech and is consistent with the FDA guidelines. It is also monitored by Genentech for adherence to program requirements. Any adverse events have already been reported to drug safety. No action is required. All speakers have been compensated, and all materials are the property of Genentech. Next slide, please. What is Evrysdi? There are a few important pieces of information that I'd like to share first before we begin. Evrysdi was approved by the U.S. Food and Drug Administration as a prescription medication used to treat spinal muscular atrophy in children and adults. This includes newborns who have a genetic diagnosis of SMA but do not yet show symptoms, known as pre-symptomatic SMA, and up to adults with SMA. Next slide, please. Some important safety information. Before taking Evrysdi, please tell your healthcare providers regarding the following. If you're a woman of childbearing age and planning on becoming pregnant, Evrysdi may harm the fetus. It is known to cause teratogenic effects. So we ask your healthcare provider to discuss options regarding contraception before starting Evrysdi. Also, your healthcare provider may also monitor you with a pregnancy test before starting. And we also ask that you continue contraception up to 1 month after stopping Evrysdi. If in the case you become pregnant while taking Evrysdi, there is a registry that we ask to collect information about your health as well as the health of your baby. And the registry is provided here on this slide. Also, too, if you're breastfeeding or plan to breastfeed, it is not known if Evrysdi passes into the breast milk and may harm your baby. So that's just a caution. If, on the other hand, if you're a male, Evrysdi has been shown in animal studies to affect a male's ability to have children or fertility. So we ask your healthcare provider to speak with you regarding taking the medication and possible sperm preservation if that's of interest. Next slide, please. Also important information is we want you to discuss other medications you're taking with your healthcare provider, as Evrysdi may have a drug interaction. Also, it's important to discuss vitamins or any other supplements you're taking. If you do get Evrysdi from the pharmacy as a powder, we ask that you do not use it and to contact the pharmacy. It should come in liquid form. We want you to avoid getting Evrysdi on your skin or your eyes. We recommend you washing your skin with soap and water. And if it does get into the eyes, please rinse your eyes out with water. The most common side effects of Evrysdi for the infantile group as well as the later onset SMA group are fever, diarrhea, and rash. But also in the infantile onset group was noted to have upper and lower respiratory infection, including like a sore throat, sneezing, runny nose, and then in addition to constipation, vomiting, and cough. And these are not all the possible side effects of Evrysdi, but these have been the most commonly reported. None of the subjects were actually who developed side effects, dropped out of our study, and we'll discuss that a little bit more later. Next slide, please. Now we've covered the important context. Let's get to know our panelists. Janelle, let's start with you. Can you tell us a little bit about yourself?
Hi, of course, and thank you for having me here today. So my name is Janelle. I'm 27 years old, and I live in Hawaii. I live at home with my parents, who are currently my primary caregivers. I work full-time as a equal employment opportunity assistant, and I do a lot of clerical work, and I assist with making sure that people receive proper accommodations for their disabilities. I've been there for almost 2 years now. I also have a passion for artwork and I have it as a side business. I started drawing in elementary school and now I make artwork whenever I have the free time to. I often come home from my office job and spend the rest of my day drawing. I go to local craft fairs and conventions, and I like sharing my art with other people. What I really like about it is that it allows me to connect with others beyond my SMA. And I also like how my artwork can inspire others as well. I also like to hang out with my boyfriend, go out to eat, watch movies, and of course, shopping.
Thanks for sharing, Janelle. Your professional role advocating for those with disabilities is so important, and your artwork is beautiful. Now, what about you, Jose?
Yeah, thank you for having me as well. I'm 46 years old and I live near Fort Lauderdale, Florida. But I grew up in New York, so I guess you could say I have the gift of gab. And I use that gift of gab as a motivational and corporate speaker, as well as an author today. And despite my SMA, I'm able to type with 2 fingers still. I'm still able to use a mouse and also sign my books, which is really important to me and cool. And on the personal front, I'm married with my wife. We just celebrated 16 years of marriage this year. Her name is Andrea. She's also my caregiver, and she's truly the MVP of our family. We met while we were working more than 20 years ago. We started out as friends. But then we fell in love shortly after. We got married on 777. Oddly enough, that's like our favorite number. But in 2007, and we created a combined family with my son Elijah and her son Zion. And now our boys are both grown and 22 and 23 years old. We're empty nesters. Recently, about 2 years ago, we just became empty nesters. And but our sons are still a big part of our lives. And we still like to hang out with one another, play guards, and go to the beach, which is some of the favorite things that we like to do. And I also now have an accessible van that I've been driving around for the last a little more than a decade with a joystick that's built into the car. And so now I can take Andrea out on dates, because previously she would have to pick me up and lift me up, put me out of the wheelchair back into, go through this whole process. So now with the accessible van, I'm able to just have her hop in and we can just ride out together.
That's a great love story, Jose. You both are very gifted and busy individuals, painter, advocate, motivational speaker, author. Both are doing amazing things. These community events are so important, and I'd really like to hear your thoughts on why you chose to join us today. Let's start with you, Jose.
Yeah, for sure. I decided to join the panel because I wanted to be able to do my part in not only sharing my story, but also by giving hope, motivation, and inspiration to the families, and those affected by SMA. And I want to be able to impact more lives. And my goal is to be able to inspire 1 billion lives worldwide. So I'm making progress towards my goals every day.
That's awesome. We'll talk more about goals and taking action to help meet them shortly. Janelle, what about you?
Well, for me, Hawaii is pretty small and we don't have a large SMA community here. Personally, I know living with SMA, it's easy to feel isolated and think that no one really understands you. But I've come to realize that the reality is everyone has their own unique challenges. SMA has taught me that you need to be flexible and willing to find creative ways to do things. I hope that by sharing my story, I'm able to make some connections with others and also share what I've learned along the way so that maybe other people can also apply those lessons to their lives. I also grew up with the MDA community and it gave me a huge sense of belonging. So I'm just really happy to be here participating today.
Thank you both. I appreciate your honesty and willingness to speak about your own personal journey. As for me, I joined the panel because I want to be more involved in educating around SMA. I have a minor in education and I want to put that to use, but being here with you today is really inspiring and I hope that the information we review is useful to you. This is going to be a great discussion, so let's get to it. As adults with SMA, our experiences and perspectives are really important. As our knowledge and understanding of SMA has evolved, we've seen a lot of challenge. We've seen a lot of change, especially in terms of treatment options that you might not have expected to see in your lifetime. So let's talk for a minute about the decision to explore SMA treatment. Janelle, let's start with you. What motivated you to seek out treatment?
It wasn't until I was in my 20s where the reality of the need for me to consider treatment options came to light. There's a lot of hesitation on my part originally about whether I wanted to move forward with treatment, but I was getting older and I know that SMA progresses and that I would be at risk of losing motor function over time. To me, creating art is my passion and it's a big part of me. And losing the ability to use my hands in the art process was a devastating thought and potential reality with SMA. So, in order to keep moving forward, my doctor and I decided that the risks of not getting treatment outweighed trying something totally new.
Thanks for sharing, Janelle. The ability to maintain motor function, especially in your upper limbs, to continue to create your artwork is a key passion and a decision factor. Jose, can you tell us what motivated you to seek out treatment as an adult?
Yeah, for me, I stayed away from the SMA community for a long time, and I was in denial a little bit, and I didn't want to be quote unquote labeled as being disabled. And so going from being independent to not being able to walk now, because I was able to walk until I was 22 years old, but from going from being independent to not being able to walk and having to ask people for help was a big shift for me. And I just couldn't handle it emotionally as well. But until I learned that there were some SMA treatments available, I was discouraged from going to see my neurologist. But then I received the MDA Quest magazine and saw information on developments and treatment options on the research page. I would always turn to that page first. And I saw a video also one time on YouTube with a man who also had SMA, and he had chosen to treat his SMA, and his perspective was really interesting to me. So I decided to make an appointment with my neurologist to talk more about taking action. So for my wife, my family, my career goals, choosing treatment was the right step for me. And I want to keep being able to play cards and go to the beach and just have fun with my family.
You each have highlighted some key points that I want to reinforce and also delve into a bit further. SMA is progressive and stabilization of motor function is key. So let's talk a bit more about this. Next slide, please. So I'm curious to know how many of you are familiar with SMN protein. If you can, just put a quick yes or a thumbs up in the chat. And I'll give you guys a few seconds. All right. The human body needs a key protein called the SMN protein, which is the survival motor neuron protein for our muscles to function. It has several important job functions within the cells that enables our body to move. It is found in all our cells and tissues throughout the body, including our muscle cells. Next slide. SMA is caused by a shortage of this SMN protein. So as a result, muscles throughout our body continuously weaken without the SMN protein, which leads to difficulty swallowing and eating, which can lead to a feeding tube and loss of motor function, like the ability to walk, requiring the use of an assistive device or a motorized wheelchair, and challenges with breathing, such as an artificial airway like a tracheostomy, which requires a ventilator. And many of these cause complications with your bones, joints, and spine over time. Now we know you both are currently treating your SMA with Evrysdi. I want to hear more about your choice in a moment. What you and our audience may not know is that Evrysdi is designed to help make more of the SMN protein throughout the body. And what happens is within 4 weeks of treatment with Evrysdi, the SMN protein levels in our blood approximately doubled, and they were maintained for types 1, 2, and 3 SMA throughout 2 years in the pivotal study. And it's next slide, please. And it's also to know that it is also important to know that there's no data available in infants under 2 months who were diagnosed with SMA who have not shown symptoms, otherwise known as pre-symptomatic SMA. This is important when we think about our daily lives, the importance of using our hands, Janelle, to create your art, or you, Jose, and keeping up with typing emails or driving your wife to a dinner date out. Your neurologist is your partner in helping you to focus the abilities that are important to you and working together to help you keep those as best as possible. What is also powerful to share is that there are many others like you, Jose and Janelle, who've made the move to Evrysdi. And as of October 2022, there are more than 1,900 people living with SMA who are taking Evrysdi in the United States. And clinical studies of Evrysdi do not include people age 65 and older to determine whether they respond differently from those who are younger. Next slide. Talking with your healthcare provider about options is important. If you aren't currently seeing a neurologist, if your healthcare provider doesn't have many patients with SMA, I encourage you to seek out a neurologist to discuss your options and make any informed decision. So now we're going to go back to our panelists. Now on this theme of decision-making, let's talk about your both decision to take Evrysdi. Jose, can you tell us about what you, why you felt confident moving ahead with Evrysdi?
Yeah, sure, absolutely. My doctor, when I visited him, he spent almost 2 hours explaining SMA in detail and providing me with all of the information about treatments that were available and how they work. I also really like that Evrysdi is an oral non-invasive medication that I can take at home or on the road since I travel often for work, and that's really important to me. And then also after talking it over with my doctor and assessing the risks versus the benefits, my wife Andrea and I decided that Evrysdi was the best option for me.
That's great. I'm glad your neurologist reviewed the options with you and considered what was important to you. What about you, Janelle?
For me, the first treatment that I started with wasn't a good fit for my lifestyle. So I reached out to my neurologist and asked him if I had other options. My doctor reviewed the results of Evrysdi with me and also talked to me about potential side effects such as rash, diarrhea, and fever. After talking it over, my doctor and I decided that Evrysdi was a good option for me, and I personally liked that I could take it at home and that it was an oral, non-invasive option.
Thank you both. It's helpful to understand like what went into each of your decision-making processes. One of you choosing treatment for the first time and the other choosing a different option that was a better fit for you. Reviewing available information, speaking with your doctor, hearing experience from people on treatment are important. So let's take a close look at Evrysdi and the clinical results you referenced. Next slide. Thank you. So these results are from one of our clinical trials called the Sunfish trial, Sunfish study. It's a 2-part placebo-controlled study in 231 adults and children aged 2 to 25 years old with type 2 and 3 SMA. So one part of the study was a placebo, which is a substance that has no active medication and is often used in studies. Part 1 of the Sunfish study explored the dose and safety of Evrysdi among 51 people, and Part 2 measured the effectiveness and safety of Evrysdi compared with the placebo among 180 people. The main measurement was the change in motor function, and the scale that was used is called the MFM32. So the change in motor function was looked at after 12 months of treatment compared to those not taking Evrysdi. And MFM stands for Motor Function Measure 32, which has 32 items that evaluate different elements to assess for head, trunk, and limb motor movement. The 95% confidence interval actually means that we are 95% confident that the actual average change in the MFM32 score with Evrysdi will be between 0.30 and 2.81 points higher than with the placebo. Next slide. So more adults and children experienced a greater than 3-point change with Evrysdi compared with a placebo after 1 year. So as a healthcare provider, I have discussions with my patients on Evrysdi, and it's important that expectations are set regarding goals of treatment. Again, in this slide, we see that there is a greater than a 3-point change after 12 months, and that there was stabilization and improvement. It is important to know that patients in this data were non-ambulatory. And in part 1 of the sunfish study, both were ambulatory and non-ambulatory. And this group, part 2, was non-ambulatory. And this chart includes only information that was collected on time. Next slide, please. These results were measured using, in this slide, we see that Evrysdi improved the upper limb strength, important for activities of everyday life. And the results that are presented on this slide were measured, again, using the ROM scale, which evaluates strength in arm movements and the ability to perform specific tasks, like using a pencil, raising a cup to your mouth, opening a container, picking up a coin. It was specifically designed for people living with SMA who have varying levels of muscle weakness. Improvements were measured over the course of a year compared with baseline measures and also between the two groups. And this slide shows that Evrysdi significantly improved upper limb strength, which is important for activities of everyday life. As mentioned earlier, in some studies, including this one, if someone misses an appointment, their progress cannot be counted in that part of the study. And the chart only includes the information that was collected on time. In our clinic at Stanford, we see our patients every 6 months to include a PT evaluation that includes different scales, such as the ROM scale, the MFM32 scale, as well as a neurological evaluation, which is collected. The 95% confidence interval means that we are 95% confident that the actual average change in the ROM with Evrysdi will be between 0.55 and 2.62 points higher than with the placebo. And in the slide, the gray line is the placebo group, and the blue line is the group taking Evrysdi. Next slide, please. Now, I'm sure everyone joining us today would like to hear more from each of you about your experience, Janelle and Jose, with Evrysdi. So let's start with you first, Janelle.
I started taking Evrysdi in June 2021, so it's been about 2 years and a little more. I knew that SMA is progressive, and realistically, I knew that treatment wouldn't be a cure, but it might help slow down the progression of my SMA. And at the time, I just wanted to preserve function in my arms and my hands so that I could continue creating my artwork. Since starting Evrysdi, I've been really happy with my results. I feel like I have better muscle control. I can lift my neck and head a little better than I could in the past. And most importantly, I'm still actively doing the things that I love.
It's important to have realistic expectations, but I'm happy to hear that Evrysdi has met your expectations, Janelle. Treatment is not a one-size-fits-all, and it's important to give it time. And you're right, we don't have a cure for SMA, but slow disease progression is a real win. Now, Jose, what about you? Tell us your experience with Evrysdi.
Yeah, I've been taking Evrysdi for about 18 months. And I too had realistic expectations and chose Evrysdi to help slow down the progression of my SMA symptoms and maybe increase the range of motion in my neck and arms as well. I've noticed that for me personally, my neck range of motion feels better when I turn from right to left, because it used to be more difficult. So I feel improvement there. But I'm also doing PT as well, physical therapy, to make sure that I'm doing everything that I can to keep as much movement and flexibility as possible.
You raised a really important point, Jose, tracking results. Everyone's experience with treatment is different. Everyone has different goals. It can be helpful to track your goals and results over time. Focusing on key skills that are important for you to maintain, talking with your doctor about your expectations over time in the first month, after 6 months, a year and longer, and then measuring your progress is helpful. How do you track your progress, Jose?
Yeah, so for me, doing regular PT, and I keep track of, my PT keeps track of my assessments every 6 months. But I'm also very in tune with my own body, and I keep a personal journal on my phone with milestones and dates of how I'm tracking.
I love how you're using your phone to track your progress in addition to your regular PT appointments. What about you, Janelle?
So because of my busy work schedule, I don't go to physical therapy on a regular basis, but I recently booked an appointment, so I'll be starting up next week. On the other hand, I am required to see my physical therapist twice a year for the Hammersmith test to evaluate my progress while on Evrysdi. My physical therapist is very pleased with how things are going, and he encourages me to do exercises such as holding a pencil or lifting a small jar from one side of the table to the other in order to help improve my grip strength, which is obviously important to me with my art. At follow-up appointments, my neurologist also tests my strength. We do little exercises, such as trying to lift my arms and my legs. He's pretty happy with where I'm at and feels like my condition is stable, with slight improvements in my hands, upper trunk area, such as my chest, as well as my abdomen and my back.
As a provider, stabilization of function and even the small, subtle improvements is positive to hear. Those are positive gains. Since SMA is a progressive disease, taking action to manage the disease is important. So I'm happy to hear you each have had a positive experience so far. Anytime we discuss the potential benefit of a medicine, it's important that we also discuss the potential risks and side effects. And earlier we reviewed important safety information, and now we'll look at common side effects again. So if you look at this slide, in the infants with type 1 SMA and also with the adults and children type 2 or 3, there's an overlap of the side effects, which include fever, diarrhea, and rash. But also in the infantile onset type 1, we also see runny nose, sneezing, sore throat, lung infection, constipation, vomiting, and cough. And again, no one in the clinical study permanently stopped taking Evrysdi because of the side effects of treatment. And these are not all of the possible side effects of Evrysdi. These were just the most commonly reported. And we ask that you, again, let your healthcare provider know all of the prescription medications you're taking, even if it includes vitamins, over-the-counter dietary supplements, stool softeners, fibers that may impact bowel movement, as there may be a drug interaction. Safety of Evrysdi in people with SMA that was previously treated with approved or investigational SMA medication is currently being studied at this time. So please talk to your healthcare provider. So from our panel, Janelle, can you please tell us about any side effects you may have experienced?
Yes, so for the first week or two, I felt pretty bloated and I had gastrointestinal upset. I decided to reach out to my partnership and access liaison, my pal, and I asked him if it was a normal thing. He said to talk to my doctor and to see how things turn out. So I spoke with my doctor, I stayed on Evrysdi, and those side effects eventually went away for me. And ever since then, I haven't experienced any other side effects since I started my treatment.
And for me,
Jose? Oh, I'm sorry, Jose. Have you experienced anything?
no, I was going to say my doctor reviewed the common side effects with me as well, but thank God I didn't experience any of them.
That's wonderful. Thank you both for sharing your experiences. Everyone's journey is different, and it's important to know about potential side effects, what to look out for, and steps to take if they happen. It is important to talk to your provider about all the medications again you're taking. It can be easy to forget to talk about everything, such as vitamins, such as B12, prescription medications like statins or dietary supplements, including stool softeners, additional fibers that may impact like bowel movement. So having an open dialogue and continuing the conversation throughout your treatment journey is quite important so your doctor can help manage any issues that you may have. You both have been taking Evrysdi for more than 1 year or more than a year. What motivates you to stay on treatment? Jose, let's start with you.
Yeah, for me, I'm happy with my results so far. I continue to be busy with work and enjoy spending time with my wife, traveling. But I'm grateful that I can still feed myself. If I'm at a table or have a surface for the food to sit on, I can still brush my teeth and shave. And sometimes it's just the small things that make a big difference. And my goal is to continue working and doing what I love. So that's why I keep on taking Evrysdi.
So once you get to know me, you'll realize that I have a ton of dreams for myself. I would like to grow my art business and brand to a substantial size, and I really just want to reach more people throughout the world through my art. I also want to learn how to drive. It wasn't until I attended my first SMA annual conference that I met other people with SMA who could drive, and after talking to others, I thought it would be possible for me too. So I want to learn how to drive as well before I'm 30 and get my own adapted vehicle. Overall, for my future, what I really want is to be able to eventually move out of my parents' house and one day live on my own with the help of my own caregivers. My boyfriend and I discussed about wanting to move in together, get married, and eventually having a family of our own.
I'm so happy for you both. That's so exciting. Now, we've talked a little earlier about the SMA community. As an adult with SMA, what advice do you have for other adults with SMA? Jose?
Yeah, I would say if you're not on treatment, talk to your doctor and try to get active because you can make a difference. Even if it's a small difference, it all matters. And to that end, there may be people out there advocating on your behalf, and that's good, but it's a totally different feeling when you advocate for yourself. And there's a sense of accomplishment and a feeling that you know what you're doing is making a difference.
As I mentioned earlier, I never thought that there would be a treatment for SMA in my lifetime. So I would encourage other adults and let them know that there are options out there and that they should talk to their doctor about it. And I'd also like to tell them that Evrysdi has given me hope for a better future. I look forward to being able to live my life the way that I want to, knowing that I'm taking an active role and doing everything that I can do in order to manage the progression of my disease.
I think it can be harder at times to see the benefits of treatment in adults, where the changes may not be as drastic as what we see in infants. However, I think it is good to think about what the goal of stability can mean versus those situations where there may be like a slow decline over time. I often find with older patients that sometimes their loved ones notice more differences than the patients do. So it can be helpful to get different perspectives. Now, before we start taking questions from our attendees, what's next for each of you? Let's start with you, Janelle.
So whenever I have the free time, I'm constantly doing research and working towards getting my first accessible van and learning how to drive for the first time in my life. So I'm super excited about that, even though it's a little daunting. I'm thinking, Jose, maybe you could give me some tips as a first-time driver. My goal is to drive in the upcoming years. I'm also super excited to attend my third QSMA conference, which is going to be held next year in the summertime in Texas. I have never been to the Lone Star State, so I'm looking forward to traveling again next year.
And you, Jose?
I'm looking forward to making a greater impact and raising even more awareness for SMA. And I'm also excited to be attending the Cure SMA next year as well. It'll be my first time in the Lone Star, so me and Janelle, we can giddy up together, huh? But and it'll be exciting. But of course, I want to continue working on projects, traveling, and trying to find more time to write another book. I just finished writing my third book and with my wife. So I just want to keep on writing books as well.
I'd like to thank you both for sharing your experiences with us today. I know your stories and journey will help empower many of our SMA patients. But before we close, I wanted to review the key takeaways from today's discussion about Evrysdi. And in this slide, we see that Evrysdi was studied in the most inclusive clinical trial program in SMA. What does that mean? That means that Evrysdi was trialed from newborns to adults with SMA type 1, 2, and 3, in addition to pre-symptomatic SMA. It was designed to help the body make more SMN protein, and safety profiles have been studied in more than 490 people from newborns to adults. And it's an oral treatment that can fit into your day-to-day life. Trials also included ambulatory and non-ambulatory individuals with different levels of disease severity and functional ability, with and without scoliosis, that was mild to severe, and with and without prior disease modifying treatment evaluated for safety. What was not really discussed too much in this program was other clinical trials, such as the Firefish trial, which is a two-part open-label trial that looked at type 1 SMA, and a Rainbow Fish trial, which is an ongoing clinical open-label trial. Open-label means everybody gets the actual drug for those who are diagnosed with SMA and have not yet shown symptoms, otherwise known as pre-symptomatic. And lastly, there's a fourth trial called the Jewelfish trial, which is a safety study, which again, we didn't talk about, but this is a clinical trial that looked at SMA patients that were previously treated with other approved and investigational SMA medications. Thank you for your attention, and I'll hand it back to our host.
Thanks, Michelle. And thank you, Jose and Janelle. A great discussion today, and appreciate, Michelle, you going through the information. I did want to just turn to a couple of questions that we've received to ask those before we end our program. All right. So Michelle, what are the most common questions you get from your patients about SMA and Evrysdi?
Yeah, thank you. That's a great question. Most patients ask if they will need to be on treatment for the rest of their lives. I tell them yes. In order for the medication to continue to work and manage the progression of the disease, you need to continuously take it. Just quickly, I know we didn't really dive into like how the medication is administered, but it's a once-a-day medication taken same time every day, and just once a day, liquid form.
All right, thank you. Janelle, this came in from a young person. They said, what would you like to share with other young people like myself who are living with SMA? You're an inspiration.
Oh, thank you so much. So, well, over the years, I've learned that I'm not limited just because I live with SMA. I encourage you to keep working towards your goals because those are important. SMA taught me that life isn't always straightforward, and although things may be challenging at times, you will be able to find ways that work for you and just keep going with it.
Thanks, Janelle. You're always so inspirational. So appreciate that. Jose, we got a question here. It said, how has treatment changed your overall outlook? You mentioned that you're an author and a father and a husband. How has that changed your outlook?
Yeah, listen, I always practice gratitude and thanksgiving, but it amazes me to see how many people are working diligently to find treatments that hopefully get us all closer to finding a cure. And I want to be a part of that. And, that's why I decided to get involved and I went all in. And in my view, the sooner you start, the sooner you may start reaping those benefits.
All right. Thanks, Jose. All right. That is the list of questions that I had gotten through the program. I'll wait another second or two, and then we're a huge shout out to MDA for thanking them for enabling us to be able to have programs like this and to reach all of you out in the community. So thank you. And a huge thank you to the panelists, Jose, Janelle, and Michelle. Thank you for your discussion today. And a shout out to the audience. We appreciate you taking time out of your busy schedules to join this webinar. So thank you very much. And thank you for participating. Also want to point out that you can visit avrisd.com for more information. We will have information on there on how to connect with the local Genentech PAL. We will also post this webinar as soon in the near future as we can. You will also be able to find it on the MDA website. And then please remember that your healthcare provider should always be your main resource for any questions or information you need. And just want to take a moment to say thank you from everyone at Genentech. We thank you for your time and your interest in learning more from our panelists and more about Avrisd. We appreciate everyone's time today, and a huge shout out to MDA and our panelists and host moderator Michelle. Thank you. Bye, everyone.
Bye.
Bye-bye.
Hi, thank you.
Thank
Thank you.